In this video, we're going to be going through the aftercare instructions for the upper blepharoplasty procedure, also called the upper eyelid procedure. And just know you will receive copies of everything that I'm about to say, so don't feel like you have to memorize it. Ice, ice, ice. Ice is very important in preventing and reducing swelling. So you're going to ice for the first 3 to 4 days after surgery. The first night of surgery, your caretaker is going to change your ice out about every 2 hours. So let them know they're not going to get a ton of sleep that night. After that, you can do about 20 minutes on, 40 minutes off, and do that throughout the day. We will also give you an eyelid mask that you can put in the freezer to use for your eyes. You have to have something to use while this is in the freezer though, so I always recommend just getting a big bowl of ice water and placing it by your bed or your recliner, putting a bunch of washcloths in. That way you can take the washcloth out, wring it out, place it on the eyes. It's gentle, it's easy, and it's effective. Whatever you want to do is fine. We just want to make sure we're not placing any ice or any frozen plastic directly on the skin because that can be harmful. You're also going to sleep elevated. We want the head above the heart, so about a 45-degree angle. This allows gravity to do its job and pull that swelling downward. If we lay down flat, the swelling is going to stay right where it is. That's a different amount of time for everybody, but I would plan on about 2 weeks of sleeping elevated. We will also send you home with a supply bag that has everything you need to care for your incisions. We're going to give you sterile water, sterile gauze, Q-tips, eye drops, ointment, all kinds of things. You don't need any of those things until we see you at your follow-up appointment. So we will go through it and we will teach you step by step. Just also know that anytime we do an eyelid procedure, the eyes can tend to get dry because that swelling in the lid makes it not as effective when you blink at keeping your own natural tears in. So we will give you a bottle of artificial tears that you can use around the clock if needed. We will also give you an ointment that you can use before you go to bed. You put a small dab in the lower lid and then you go to sleep. And this keeps you from having to do the eye drops all night long. If you're only having your eyelids done, there's no restrictions on what you can eat. If you can tolerate it, you can eat it, but do avoid excess salt. Salt makes swelling worse, so be careful when we're getting canned soups, canned meats, that type of thing that has a lot of salt in it, so get the low sodium kind. You can shower anytime after we see you at your first follow-up appointment, as long as you feel up to it. If you're dizzy or lightheaded, just wait. But it is okay to wash your hair. It is okay to get your face wet. You won't hurt anything. Some things that are normal. People tend to feel worse before they get better. This usually happens around day 4 and 5. This is a combination of feeling physically worse, a little more swollen, just kind of dragging, but also emotionally, it's a hard time because you feel like you should be 100% healed, but it's only been 4 days. So we have to be realistic. We have to know that our body is healing, even if we can't see it. I always tell people, don't look in the mirror every hour and expect to see changes. There won't be any. It's more of a day-by-day, week-by-week process. Mild swelling and bruising lasting over 2 weeks, that's normal. But at that point, you can wear makeup, wear your hair differently, wear eyeglasses. All of those things can help camouflage any residual healing. Some things not to do. No exercise for 2 weeks. We don't want to increase the heart rate or the blood pressure. You can do light activities. You can walk gently. You can do light housework, but nothing strenuous for 2 weeks. And of course, if you have any signs of infection, like redness, heat, fever, pus, call. I always tell people the easiest way to prevent infection is common sense. Wash your hands frequently. Use clean towels, clean pillowcases. If everything is nice and clean, we drastically reduce the risk of infection. And just remember, we're going to give you copies of all of this, and we're always here to answer questions. So if that wasn't clear, feel free to watch the video again, or feel free to ask us when we see you at your appointment. Thank you.